If you want to learn a lot about rapid cycling bipolar disorder, you come to the right place. Today on Polar Warriors, we're going to talk about what rapid cycling is, how it's diagnosed, the symptoms, and some interesting statistics to go with it. Now, this makes video number 5 in our series called Faces of Bipolar Disorder. And so far, we've managed to cover diagnosis, bipolar type 1, type 2, cyclothymia, and now we're moving on to some of the courses and symptoms of the illness. If you really want to learn a lot about the illness, make sure to check out the other videos in that playlist. Rapid cycling isn't specifically a diagnosis like type 1 or type 2. It's more of what we call a course specifier or a descriptor that goes along with the different types of bipolar disorder. Now, one last side note before we jump right into the good stuff, my channel is not monetized with annoying advertisements by choice. I don't make a dime doing this, and it is a lot of work to research and make videos of this quality. So if you feel my channel is helping you out in any way, please consider showing your support by subscribing and liking the video. Now, that isn't for my ego. It actually increases the chances that these videos can be seen by others who need the help. And my goal is to simply help as many people as I possibly can to basically not suffer like I have most of my life. All right, so here we go. The term rapid cycling first came about in 1974, which was a little bit before my time, when psychiatrists noticed a group of lithium unresponsive patients that were found to have multiple episodes of mania and or depression over a period of a single year, much more so than just their typical bipolar patients. There was just a notable difference, and eventually it was validated and then actually incorporated into the DSM as a course specifier for bipolar disorder. For those of you that don't know, the DSM is the Diagnostic and Statistical Manual of Mental Disorders, and it's kind of like the go-to book for psychologists around the world to determine the criteria for any mental health diagnosis. Now, depending on which source you read, about 10 to 30% of people who have bipolar disorder will experience rapid cycling. To be diagnosed as a rapid cycler, a patient has to experience at least 4 episodes of mania, hypomania, depression, or mixed states within a year. After each episode, the patient has to return to a euthemic state for at least 2 months, which is basically a fancy word for stable, or they have to experience a switch in mood polarity. I know this sounds like a bunch of technobabble or medical jargon, so if you aren't clear on what hypomania or mixed states are, we will absolutely get there later in this series, so hang in there with me and you're going to learn a lot about bipolar disorder. So eventually rapid cycling was classified even further when they found that a lot of patients cycle a lot faster than just every few months, like me personally. I have what's loosely known as ultra rapid cycling, which means I experience cycles pretty much every single month, sometimes a lot more often than that. And then there's ultra rapid cycling, where people can cycle weekly or even daily with manic and depressive episodes. I'm kind of somewhere in the middle personally between ultra and ultra rapid cycling. So to put this into context, that would be like waking up in the morning feeling like you want to take over the world, and then later that same day you're paralyzed in bed with depression. I mean, just imagine how hard this could be for those even around us to understand or watch us go through. That's why being educated about bipolar disorder is just beyond crucial. It wasn't until my late 20s that I started rapid cycling, so it can develop basically at any time, and for some patients it can come and go throughout their lifetime. A lot of people assume that rapid cycling makes the symptoms of bipolar more obvious, but because most rapid cyclers experience more depression than mania, they can easily be misdiagnosed with unipolar depression instead of bipolar depression. Unipolar basically means experiencing either depressive or more rarely manic episodes, but not both, like with bipolar disorder. Now, for some not so fun facts about rapid cycling bipolar disorder. People who rapid cycle, unfortunately, have a higher risk of suicide. They can also end up hospitalized a lot more often, and the symptoms can be harder to treat long term because of a noticeably higher resistance to treatment. For some reason, it's a lot more common in women than it is men, and it's been associated with earlier age when it comes to the actual onset of bipolar symptoms. Something really important that we need to be aware of is that there's increasing evidence that shows that substance abuse or the misuse of meds, like especially stimulants, can be huge factors in causing or provoking rapid cycling. Substance abuse just runs rampant in the bipolar world, and it's associated with way worse symptoms, and it makes it harder to treat the illness. In fact, nearly 60% of people who have bipolar disorder use drugs or alcohol. This is what's known as a dual diagnosis, and we'll cover that thoroughly in a future video, considering how crucial that is. If you're drinking or using drugs like I did for many years, it can almost make it impossible to know which meds are even working or to distinguish the difference between symptoms and side effects of whatever you're taking or drinking. I know all about self-medicating, and it causes rapid cycling to get just out of control. Actually, looking back, the most damage I ever caused in my life and to others around me was when I was abusing substances. It was also when I came the closest to ending everything. Anyways, let's move on to how rapid cycling is treated. Please note that medication is a sensitive topic for some people. I'm not a doctor, and I'm not going to discuss what I take or what works for me, because everyone responds completely differently to different medications. That being said, let's continue. Antidepressants like Zoloft, Prozac, Paxil, and others can sometimes be ineffective on their own in treating the depression of rapid cycling bipolar disorder. They've actually even been known to increase the frequency of new episodes, especially if they're used just by themselves long term. This is where we get into a classification of drugs known as mood stabilizers, which treat more of a broad range of symptoms instead of just the depression. Examples would be lithium, Depakote, Lamictal, and countless others out there. A lot of the time, a single mood stabilizer still isn't enough, though, to prevent episodes from reoccurring. So it's common for patients to need combinations of meds. There's also another class of drugs known as antipsychotics like Zyprexa, Seroquel, and others that have also been really effective in combination with other meds to prevent rapid cycling. Now, the name antipsychotic sounds major, and patients don't have to experience psychosis like delusions and hallucinations for these meds to be prescribed or effective. Once we find the right combination of mood stabilizers and or antipsychotic meds, we usually stay on those indefinitely, even if symptoms stop, because staying on the meds is what provides the stability or prevents episodes from recurring in the future. If antidepressants are being used in the mix, a lot of the time they'll get tapered off once the depression's under control. But like I said, medication is different for everyone and extremely relative to each individual and their circumstances. So finding the right medication or combination is going to be up to you and your doctor. No one else can make that recommendation. I think I'm going to wrap things up here, and we've covered a lot of information in this video on rapid cycling. Like I said, this is just one video in a complete series about bipolar disorder that we're working on. So please make sure to check out the other videos. That way you can learn as much as you possibly can about this illness. Self-awareness and education can be almost right up there with meds when it comes to a comprehensive treatment program and what's effective. So if you made it to this part of the video, thank you for taking the time to learn more with me and for taking responsibility for your health. Not everyone is at a place where they're even ready to do that. So for what it means, I'm proud of you for being here, and I hope to see you back here soon for another Polar Warrior video. Stay well.